program is proudly brought to you by Datec PNG Limited.
In this session of Infocus, we open up with a discussion on the prevalence of cervical cancer in Papua New Guinea with our panelists, Dr. Mary Rose Bagita, obstetrician and gynecologist at the Port Moresby General Hospital, and Dr. Connie Sobi, Director for Medical Services at the Port Moresby General Hospital.
Dr. Connie Sobi and Dr. Mary Bagita, thank you for joining us.
Thank you for having us.
Now, firstly, Dr. Bagita, how alarming is the prevalence of cervical cancer in Papua New Guinea?
Thank you for that question. I think before we come to Papua New Guinea, it's good to have like an idea about what's happening globally. So then we come down to PNG. So if we look at global figures, every year we have about 600,000 women diagnosed with cervical cancer, and every year about 350,000 women die from the disease. So these are all global figures. And then when we come down to the Melanesian region, Melanesia has the fourth highest rates of cervical cancer globally. So that's quite a lot. When we look at figures, we're talking about age-specific rates of close to 28 for every 100,000 women. That's quite high. And we're fourth after three regions in Africa. And then when we come down to the Melanesian region, Fiji and Papua New Guinea have the highest rates in the region. So currently Fiji has the highest rate of cervical cancer in Melanesia, and PNG is close after Fiji. So that's just new cases diagnosed every year. When we talk about deaths, Melanesia is also the region that has the fourth highest deaths due to cervical cancer globally. And that's after these three African regions. And again, when we come down to Melanesia, Fiji and Papua New Guinea have the highest death rates in Melanesia. In PNG alone, every year we're looking at about 1,100, over 1,000 new cases diagnosed every year. And out of this, about 600, more than 600 die. So these are not data that's collected. These are all projections from data that we have, and it's quite alarming. When we talk about alarming, it's alarming because our rates of cervical cancer are among the highest in the world. In comparison to Australia and New Zealand, which are our closest high-income developed world, their rates are quite low. So in comparison to that, our rates would be about 5 to 6 times higher than what is in Australia and New Zealand. So these are very high rates.
What would you attribute this trend to? Is it a lifestyle practice or genetically prevalent?
So we now know that the majority of cervical cancer is due to a virus called human papillomavirus, which is transmitted from one person to another. And we have, wherever there's high rates of human papillomavirus infection, there tends to be much higher rates of cervical cancer. So in Papua New Guinea, from studies that have been done by the Institute of Medical Research and other studies around the country, our rates of HPV are quite high also. It's about 15% of women. And this is in comparison to other countries where they have much lower rates of cervical cancer, which will be, much, much lower than 10% of the women population that have the human papillomavirus infection. So it's just a persistent infection that doesn't go away. Normally, I said 15% with the human papillomavirus, but it's actually quite a common infection among women. But why most women don't develop cervical cancer is because the body takes care of it. So when a woman gets infected with the human papillomavirus, the body gets rid of it within about 2 years. It's self-limiting. The body just does its own job. But sometimes the virus persists, it doesn't go away, and these are the ones that progress on to causing changes in the cervix and eventually to cervical cancer.
How critical is early detection?
Probably the most important bit of treating cervical cancer is early detection and prevention is the way to go, because then you prevent at different stages before it becomes invasive cancer. So what we know about cervical cancer is it's actually the only cancer currently in the world that can be eliminated. Studies have shown that it can be eliminated, it can be prevented, it can be treated. Women don't need to live with the disease and cause so much disability and detrimental effects on women and their families. It's a cancer that can be eliminated, that can be prevented. So that's why we would rather prevent than treat when someone has cancer, mainly because, treating something that has already become cancerous, it's a lot more resources needed, a lot more skill required, a lot more expenses, on the health sector budget, on the family. Financially, it's a whole lot more challenging than if we prevent it in the first place. And that goes a lot for so many other diseases as well, that prevention is a lot better to handle than trying to cure something.
Are there early symptoms or stages of the disease that we should look out for?
There are very early symptoms, but before we reach the symptoms, it should be screened and prevented. So the earliest symptoms of cervical cancer is unusual bleeding that the woman complains of. And one of the most common symptoms is what we call postcoital bleeding, or that's bleeding after sexual intercourse. So any bleeding after sex should ring alarm bells. That means that if this happens, a woman needs to go to a medical facility and get checked. So I would say that is the earliest symptom. There can be other symptoms related to bleeding, which is just any unusual bleeding. So bleeding in between the periods, bleeding, heavy bleeding. And another complaint that women usually come with is foul-smelling discharge, vaginal discharge. So those are the two most common symptoms. The earliest is bleeding after sex.
Now, Dr. Sobi, in your opinion, how costly would you say the treatment available in the country to treat cervical cancer?
To treat cervical cancer, usually the advanced stage that come to the specialists will require a lot of resources, as alluded to by Dr. Bagita. That includes drugs, chemotherapy. That also includes other tests to further investigate the extent of the cancer, like scans, various other blood tests, and of course surgery, and of course radiation therapy where it is required or indicated, particularly in the treatment of cervical cancer. These interventions are themselves quite expensive. Chemotherapy is expensive. Radiation therapy is expensive. At the moment, we only have one radiation facility, although it's not fully functional as required for treating specific cervical cancers in the country. But that is what we are aiming to develop at Port Moresby General Hospital.
I understand there's currently work underway to build a cervical cancer unit. Could you give us a background on the project?
Yeah, so this is more like the cervical cancer screening facility that we are building, where the Suso Mama used to be, the old facility, which is at the entrance of the McGregor wing of Port Moresby General Hospital. So this is an initiative that we are taking together with the support of We Are One Foundation, Islands Petroleum. We are grateful for that. It will be first of its kind in a public facility in the National Capital District. I understand there is a NGO program that's running a clinic down in Badili, which, of course, clients pay a small fee just so that they can sustain it. But for this cancer screening, cervical cancer screening, will be first of its kind, developed, established there at the Port Moresby General Hospital.
I would imagine patients would not need to travel out to access these services. Perhaps they'll be accessing it at POMGen.
Yeah, so we need to have a robust and a very clear referral pathways from various clinics around the city and even our neighboring provinces of Central and Gulf, so that families, especially mothers, are not disadvantaged in looking and accessing this facility once it's established.
Now, finally, what would be your call to the greater public in terms of how they can best address the prevalence of cervical cancer?
Yeah, so for the greater public, it's important that, as Dr. Bagita alluded to, early detection or screening programs is most important and most critical in my view, so that we can negate the need to have all these expensive diagnostic processes and treatment, combination of cancer, chemotherapy or drugs, surgical as well as radiation therapy. So early screening and detection, and it's incumbent on us, the healthcare facilities, to make sure that services for early screening detection services are provided, particularly for cervical cancer, not only in Port Moresby, but I believe throughout the country.
How critical is the support from partners like We Are One Foundation?
Yeah, so it's very important. Government alone cannot provide all the healthcare services that the people of this country and those who live in here require. So we are grateful for the support from our NGOs partners, and in this case, thankful for We Are One Foundation.
Now, Dr. Sobi, why wasn't POMGen able to build a cervical cancer unit in the past?
Yes, so there's a number of reasons, and when it comes to cancer, in order for government or any institution to build facilities, it needs to be data-driven. As you know, cancer cases or registry in the country has been fragmented, so we don't have a robust cancer registry system in the country, and so it's everyone treating cancers in their respective locations, and there's no data sharing so that can lead and guide us, the government and the healthcare professionals to lead, advise the government appropriately to build centers such as this. Not only cervical cancer, but mouth cancer, lung cancer, liver cancers, and various other cancers that our people endure every year.
Dr. Kwani Sobi and Dr. Mary Bagita, thank you for joining us.
Thank you.
Thank you.
Welcome back to Infocus. In this session, we are joined by Isabel Juma and David Avusi, both from the We Are One Foundation. We discussed the community support programs the We Are One Foundation is providing in the health sector in Papua New Guinea, and most notably its fundraising Mother's Day Music Festival.
Douglas Avusi and Isabel Juma, thank you for joining us.
Thank you so much.
Now, firstly, Douglas, Could you tell us about the history of the Islands Petroleum and how the We Are One Foundation came about?
Thank you. Islands Petroleum has been in the country for 40 years, and it's founded by Paul Blewett. He's the founder and the owner of the business. It started off as a humble transport business, and then it moved into acquiring the Mobile partnership and expanding its operation throughout the country in certain locations. So 10 strategic locations has the business been established in its depots. The business also has committed itself in supporting community engagements, apart from just its quality support in petroleum and lubricants. Islands Petroleum is the sole distributor for mobile lubricants as well. And this is for the business. It is now engaging into the foundation. So establishing the foundation, it supports its corporate social responsibilities in moving forward and expanding to support our health and education in the country. With that, how many years of operating in PNG, the business is now committed to having a foundation. And We Are One Foundation is calling, it's more to do with everyone's support, everyone's contribution, and everyone's partnership in helping our health and education in the country.
How different is the We Are One Foundation approach to philanthropy and social community obligations?
It's very different, actually. As opposed to charity deals with top and down, top to bottom. This is philanthropy. It's got a more of a philanthropical approach. This is we mobilize the whole community, all the corporates, all the NGOs. We get them all together and for a good cause. And we also do a lot of awareness and making sure that they're aware of why we're doing this and who they're helping. And when the funds get distributed or disseminated to all the projects, they're aware of where it's going. So yeah, it's a very different approach to a charity, a standalone charity.
Now, Douglas, what would you say are some of your notable impacts, or rather, some of the notable impacts of the We Are One Foundation?
We Are One Foundation established its footprint last year in November. And with that, from the Color Run is one of its Islands Petroleum's significant events that's been supporting our health and education. So it's now come under the foundation, and it has helped a number of hospitals, clinics. And from last year's Color Run itself, we've supported POM-JAN, and we've supported Lay. There's a Milford Haven Clinic and Milford Haven Primary School. And in East New Britain, where it was hosted in Kokopo, it supports St. Mary's Hospital and Nonga General Hospital. So these projects in those hospitals and clinics and the school has really helped our community in those areas. Foundation is now looking at the Cervical Screening Center here in Port Moresby, which we are happy to work with the Port Moresby General Management and Administration in having that cervical screening center established for our women and our girls in the country. Yes.
As you mentioned, there were significant funds raised over the years. You currently have a major fundraising event that's going to be happening. What is We Are One's foundation approach to accountability and transparency?
That is a very good question, and we are really happy to answer that question and share that information with the public as well as with other stakeholders, as Isabella has mentioned, regarding the stakeholders partnership in working together to raise funds to support our health and education programs. And this is where the mechanism comes in. Funds are collected through sales of a certain merchandise and partnership contribution to support this event and also raise funds for the purpose of those projects is then put into accountability finance reporting from our end. So we do procurement, our team does the procurement through the project proposals submitted by those institutions. So funds is not given out, but funds is just kept in the trust account where we manage how it's spent based on those project proposals. Then we can be able to provide financial reporting back to our stakeholders and share this information with the public who has contributed in purchasing the shirts through Color Run and also this upcoming event for the ticket sales.
Douglas Avusi and Isabel Juma, thank you for joining us.
Thank you
Thank
so
you.
much.
Well, that ends this episode of Infocus. Do join us again next week, Monday, on our regular time slot of 7 p.m. Till then, bye for now.
This program was proudly brought to you by Daytech PNG Limited.